Good day. For today's video, we are going to discuss Health 10. Quarter 3, Module 1. Significance of Global Health Initiatives. Introduction. Global health is the understanding of healthcare in an international and interdisciplinary context. It includes the study, research, and practice of medicine with focus and emphasis on improving health and healthcare equity for populations worldwide. Global health initiatives cover both medical and non-medical disciplines, such as epidemiology, sociology, economic disparities, public policy, environmental factors, cultural studies, etc. Global Health Initiatives. Number 1. Global Fund. Number 2. Global Alliance for Vaccines and Immunizations, Gavi. Number 3. World Health Organization. Number 4. United Nations Development Program, UNDP. Number 5. United Nations International Children's Fund, UNICEF. Global Funds is a partnership designed to accelerate the end of AIDS, tuberculosis, and malaria as epidemics. Is a financing mechanism rather than an implementing agency. Global Funds initiatives. Accelerating the end of AIDS, TB, malaria as epidemics. Global Fund mobilizes and invests more than $4 billion a year to support programs run by local experts in more than 100 countries. The money comes from 92% from donor government and 8% from the private sectors and foundations. The budget is spent to support programs that fight AIDS, TB, and malaria. The effective implementation and monitoring of grants is at the core of our work to end of HIV, TB, and malaria as epidemics, and forms the longest part of the funding cycle. Importance. The fund bolsters initiatives and programs that fight TB, malaria, and AIDS. Sufficient budget gives the mechanism to sustain certain programs anchored on such noble objective. Global Alliance for Vaccines and Immunizations, Gavi. A global vaccine alliance, bringing together public and private sectors with the shared goal of creating equal access to new and underused vaccines for children living in the world's poorest countries. Health initiatives. Innovation for uptake, scale, and equity in immunization, INFUSE. It helps improve vaccine delivery systems by connecting high-impact, proven innovations with the countries that need them most. It then infuses the innovations with capital and expertise to help take them to scale. Importance. It ensures that vaccines for immunity are sufficient in target countries. This helps boost the immune system of target beneficiaries. World Health Organization. It is designated to serve as the lead agency tasked to direct and coordinate with all member nations regarding leadership, supervision, technical support, and education on matters about health. Health initiatives. Alliance for Healthy Cities. It is an international network aiming to protect and enhance the health of city dwellers. Partners with a variety of governmental and non-governmental actors to respond to challenges across the region. Developing strong partnerships allows us to leverage the strengths of a range of global health players to bring better health to the people of the region. Importance. It encourages local governments to incorporate health issues and health concerns into all aspects of public policy. WHO's global strategy to reduce the harmful use of alcohol. It is a resolution on public health problems caused by harmful use of alcohol approved by World Health Assembly, year 2005 WHA 58.26. Thus, recognizing that alcohol has a worldwide impact, and that strategies exist to reduce such an impact. Importance. It establishes norms and creates a framework to support both domestic action and international cooperation on alcohol consumption. It reduces harmful use of alcohol through effective policy measures, and by providing relevant infrastructures for tobacco control in target countries in the whole world. United Nations Development Program, UNDP. It is the United Nations Global Development Network. It advocates for change and connects countries to knowledge, experience, and resources to help people build a better life for themselves. It aims to eliminate poverty and achieve sustainable economic growth and human development. Health Initiatives. UNDP Strategic Plan. It is anchored on the 2030 Agenda for Sustainable Development, and committed to the principles of universality, equality, and leaving no one behind. Supporting countries and communities in building resilience to diverse shocks and crises, including conflict, climate change, disasters and epidemics. Importance. It helps countries in achieving sustainable development by eradicating poverty in all its forms and dimensions. It accelerates structural transformations for sustainable development, and building resilience to crises and shocks. United Nations International Children's Fund, UNICEF. It is a United Nations agency responsible for providing humanitarian and developmental aid to children worldwide. It is among the most widespread and recognizable social welfare organizations in the world, with presence in 192 countries and territories. Health Initiatives. Digital Health Initiative. It is an initiative to strengthen health systems by designing and deploying digitally enabled solutions. It supports research that leverages technologies and methodologies from computing and data sciences to tackle a range of applications related to healthcare systems, from medical informatics to healthcare delivery and administration. Importance. It lessens the number of children that misses life-saving vaccinations, treatment, and health monitoring which outdated health system fails to keep on track. Strengthening health systems. It is an inclusive health system for children to survive and thrive and become a resilient individual. Importance. It provides access to safe water, sanitation, hygiene, and provides support to primary health care, especially at the community level. I hope you learned something in our lesson for today. See you again in our next video. Thank you for listening.